And welcome, ladies and gentlemen, to this very special segment today on the 18th day of May 2021. Well, it's wonderful to have your company, and it's a beautiful day out there. And today we'll be talking about some of the things that are happening right here in Australia. When are the borders going to reopen? Should we reopen them? What safety precautions need to be put in place? And we will, of course, also look at some of the other health crises or health situations which are arising. And of course, why isn't that proposal in Toowoomba going ahead? And we'll hear that from our Prime Minister as well. So, but first of all, let's take a quick look at the borders and what's happening there. Should we reopen? When and how and what would it look like?
Laura Tingle, leaders in politics, health, business, more of them are starting to speak frankly about the need for Australia to adapt to viewing the risk of COVID like it views risk around every other public health challenge once vaccination is further advanced.
They do, Lee, and I think it's sort of interesting to see how rapidly this discussion is sort of evolving. There was a group led by the University of Sydney that came out on Friday with a really long report just contemplating what's happened to us as a society during COVID, as well as to the economy, and trying to set out a roadmap for coming out of it in a whole range of different ways. But I think in some ways, the fact that the budget didn't really sort of address this, didn't really say, OK, well, here are the issues we've got to think about now, has really crystallised that discussion for people to say, well, hang on, we can't stay closed like this. It might feel safe, but it's just not viable. We will lose our competitive advantage in a lot of economic areas. Families are going to be separated across the world. We've got to find a way out.
Nobody seems to know what that path is going to look like, though, what it would take for international borders to open. For example, what percentage of the population would have to be vaccinated, whether if you've had a vaccine and you want to have a one-week holiday in Fiji, are you then going to be expected to endure 2 weeks of hotel quarantine? There's a million questions like this. The Prime Minister seems in no rush to clarify any of that, and nor is he in any rush to open borders. Why is that?
Well, I think without a doubt there is politics involved in this, Lee. Scott Morrison saw that the state premiers got a lot of a big fillip from being hardline on borders, and he, of course, was attacking them for a lot of that last year. He's now decided to adopt that position, but I think we saw today that he started to recognise that he has to start talking about this publicly, whatever's going on behind the scenes, because people do want to know. As you say, there are so many issues to be sorted out. It's not a matter of just opening the borders one day. It's looking at particular sectors. It's looking at questions about immunisation. He's saying it'll start with allowing people who've been vaccinated to travel within the country, even during state lockdowns.
The people in the Keep the Borders Closed camp, including the Prime Minister, would also make the argument that things can actually get out of control really quickly.
Well, they might be able to get out of control pretty quickly, but it basically comes down to having not just a vaccinated population, but proper and adequate quarantine facilities. And this is the thing where the Prime Minister's really been dragged kicking and screaming, really determined to make sure that this is an issue for the states, no matter what his constitutional responsibilities are.
Laura Tingle, thank you.
Thanks, Lee.
Very much for that report. As we know that in our politics can never be ruled out, but of course health and safety and security also does count. So we really need to be mindful of that as well. Well, right now let's join the big picture in what's happening with the cases right in India.
The complete owner of the program. And there are only two strategies of doing it. One is a very aggressive containment strategy, which means if outbreaks like Maharashtra and Kerala were to be the first thing to be noted in third wave, we should be able to prevent the transmission right there. So that's what we mean by aggressive containment. And this cannot be happening only at the national level. This has to be very local. And for that, the right question to ask is, how many cases are you detecting? If you're not detecting enough, that means you're not doing good enough of a job of doing surveillance. That's the one approach. Currently, the culture is different. If you have fewer cases, you will be lauded. and if you have higher cases, then okay, there is a problem. So that's the approach to tackle COVID-19. The second approach is vaccination. Again, we need to be increasing the speed at least to 10 million doses per day, at least to cover the vulnerable people before December. And December is around when we can have the third wave. So if you are able to cover the vulnerable and step up the aggressive containment measures, even if you don't cover everybody with vaccination, we can reduce the total number of deaths and the hospital admissions in the vulnerable age group. I'll give you an example of United States of America. If you look at their fourth wave, it is very small peak. The deaths are fewer, hospitalizations are fewer. They had 4 waves. And if you compare the earlier 3 waves, they are devastating. So I don't want to see a devastating third wave. For that, we need aggressive containment and a very faster and wider vaccination coverage.
Absolutely. Vaccination seems to be like the best option in first tackling with the second wave, the ongoing one, and then preventing a third or a fourth wave in the country. So time is running out. With that, I'll have to call it a wrap on this edition of The Big Picture. Thank you once again to both my guests for joining me on the program, putting across your thoughts before us and our viewers, helping us understand how to deal with a potential third wave, prepare ourselves, and also continue to maintain COVID-appropriate behavior, because that is the least that we as citizens can do. So thank you once again to both my panelists for joining me on the program, and thank you to my viewers as well for your time. Take care of yourselves and your families, and see you again tomorrow.
Thank you very much for that report, Tinaja. And right now, we'll move on with the local news here. And Greg Hunt, our health minister, dismisses the case of COVID.
Qantas is going through its assessments, and what it has done is it's identified a large number of positive cases that would otherwise have come to Australia. It's very clear that the testing processes in place prior to us putting in a pause were not revealing a high percentage of COVID cases, which were then being revealed in Australia. And so we've taken steps. Our understanding is that the Qantas process is strong and rigorous, but everybody, on every day through the pandemic, is focused on continuous improvement, and that's been our engagement with Qantas, and that's been their engagement with their providers. I understand those providers are well respected in India, but I will let others look at that. But also, it's very important to understand that somebody may test negative during an incubation period and then become positive. Equally, somebody may test positive and then subsequently become negative as they clear the virus.
So that was about people who have been left out on boarding the flight, on coming back to Australia from India. And why has that been the case as well, as we looked at the first report there as well? Well, the airport in Toowoomba is not a Goa. Why is that so? Let's hear from our Prime Minister.
Well, the problem with it is we've never actually had a proposal. And the details, when you compare what's been put forward by the Victorian government, is chalk and cheese. Victoria has put a very comprehensive proposal to us, something we can actually work with, and we are. One of the biggest difficulty with that proposal is it's not near a major capital city where there's a major hospital. That's the big problem with it, amongst many others. We still couldn't get straight answers on whether this proposal in Toowoomba was about replacing hotel quarantine or supplementing hotel quarantine. So there was just not enough detail, not enough answers to the questions that you needed to properly assess them. So I think it's reasonable to say that it hasn't been stacking up very well, particularly when you compare it to a very comprehensive and well thought through proposal from the Victorian government.
Well, so Toowoomba up against Victoria, and Victoria has put forward a very comprehensive and well thought of plan. And the proposal from Toowoomba, as for the Prime Minister, is not even a full proposal as it stands at this point in time. Well, right now, moving on, health officials are now worried about the spike of a different nature.
What we're seeing is an increase in syphilis over the last few years, and what's happening is that syphilis is spreading through the community into areas it wasn't present in before. So that includes young women in outer suburbs of Melbourne, the outer northwest and the outer southeast. And this is concerning because some of these women are getting infection during pregnancy, and that's resulting in infection of babies.
So genomic testing is going to give a clearer picture, and we'll get to that in a moment. But for now, what you're saying is we do know that it's infecting women at a really worrying rate.
That's right, Gemma. So infections during pregnancy can be very serious, and what we know is it's absolutely preventable. If pregnant women are screened for syphilis with a blood test and they're treated early enough, infections of babies can be completely prevented. So it's really tragic when that happens.
Now, tell us about the introduction of genomic sequencing that will change the outcomes for individuals, how it can be used to halt the spread.
Yeah, so what we're working on at the moment, Gemma, is doing genomic sequencing of syphilis strains that are picked up during testing in a similar way that's been used for COVID. So we're working with Professor Deborah Williamson at the Doherty, and Professor Williamson's actually developed the genomic technique to do that. What we need to do now to take it forward is to be able to combine that with information we have from people who are diagnosed with syphilis, including where they live, to actually generate images of strains circulating through the community so we can target our interventions such as testing control to the areas that are most affected or most concerning.
So it's early days at the moment, but this genomic sequencing, it could be shutting clusters down before they even begin, providing a snapshot as to how it's spreading, and I suppose also giving a more clearer picture as to numbers.
That's exactly right, Gemma. So it'll just mean that we have a better understanding of where the syphilis is circulating, deciding which areas really need to be the focus of control, and then channeling all our resources, testing, treatment, contact tracing to those areas.
Now, you mentioned the congenital syphilis, the unborn babies infected with syphilis just moments ago. There have been cases, and obviously the outcomes are not good in many of those cases. You say that that's a sign that public health controls have broken down. What do you mean by that?
Yeah, so we know, Gemma, that to control syphilis, if you do enough testing, enough correct treatment, enough of the contact tracing, and you can focus those in the areas of greatest need, so there's access to all of those, then you should be able to control syphilis. So that's where the focus should be now, in figuring out where are the priority areas and really increasing the intensity of all those interventions.
Now, I have to ask, this genomic sequencing work, is it a result of COVID, or was this underway before COVID?
Yeah, actually, the work we started a couple of years ago with the Doherty, so we actually had started this before COVID, but COVID has really highlighted the potential benefits of genomic sequencing if you can put that out into the real world. And in fact, many of the control measures that will improve syphilis are analogous to what have been done with COVID. So your testing, your termination of the infectious state, your contact tracing.
And of course, the testing and the genomic testing will be a vital tool now that it is here. And as was said, that for syphilis, it was not just because of COVID. Some work had already been done in that area. Well, right now, there's been some commentaries coming in and some messages that we've been getting that, anyone who's sick or traveling from India should be banned of coming into Australia. And I think that goes for anyone from anywhere. This is one of the discussions which we have been having in the very beginning, was that, if anyone boards a plane from wherever, whichever country they're coming, they need to be tested. And should they, be found to be sick and whatever, they just don't get on the plane. So regardless of, people are saying that there are many families which have been separated. Some of the part of the family got approval to come, others could not. Well, the simple reason is because, if you have tested positive or you have shown signs, you could be asked, off the plane, or you could not get an opportunity to board the plane. So, I mean, if you look at many other countries where the virus has actually been brought in from, there have never been locally acquired cases, but there have been cases from travelers, from people who had come from overseas. So, first we have to get them in, then the quarantine. All this is a big, huge cost. And it's not an easy exercise to go through, but this is what people have been doing. So I think it is just common sense that people get tested, and if they are sick, simple as that, you don't get on the plane and you don't get a chance to come anywhere. Hard and harsh as it might sound, but that is the reality. And looking at COVID-19 and everything, people are saying that this is something that we might have to deal with in a long-term basis, meaning it's here to stay. So just like the other vaccines, the vaccinations that we get, the flu shots that we are all so used to, which I got this morning, and in another 2 weeks I get the vaccine, is that we'll get used to that. But, even the borders, international borders could even have been open earlier with this provision of testing, to say people get tested, and if they are not well, and if they show some signs, they don't get on the plane. Others can come and, and go. So that could have been one measure, but, one can't be too careful, especially when the health of an entire nation is at risk. Well, right now, we will continue with that. We will go to India after the break because there is lots of things that we need to talk about. But right now, let's take a quick look at a message from our sponsors.
GlobeNet Realty. GlobeNet Realty has been the longest established, trusted and respected agency in its trade area. Washa Chandra, Director of GlobeNet Realty, provides honest and ethical service to her customers. If you are thinking of investing in Brisbane real estate market, or if you are seeking professional property management, then you should contact Usha Chandra today on landline 3865 4466 or mobile 0419 775 416. And for further updates, log on to our website www.globenetralty.com.au. GlobeNet Realty is your own local real estate agency. Situated at Shop 52281 Sandgate Road, Boondall. GlobeNet Realty. Real estate is our world.
And of course, real estate is the world. And don't forget that tomorrow we have the real estate update with Usha Chandra right here on this channel. Well, right now, let's continue with that debate. It's not a debate, but it's a discussion on the border closures and especially restrictions from India.
Across India's capital, popular tourist sites are empty. Residents are holed up at home in a desperate attempt to keep the crisis from worsening. A makeshift hospital is being built to help take the pressure off a hospital network drowning in cases. But for millions in Delhi, the damage is done.
I have seen whole family vanishing in this train. I have cremated 5 members of one family.
Jayant Malhotra and his father Tranjeev usually run an electrical wiring service. For over a year, they've provided free cremation services to more than 1,000 desperate families.
Whenever people say to share your experience, I get goosebumps. 9-year-old child died due to the shortage of oxygen. Pregnant lady died due to the lack of treatment.
I had to travel 8 hours from Delhi within a blink of a second. I had to call my parents to come pick me up, and it was all...
For stranded Aussies like Sheena Snatter, this is the crisis she cannot escape. She came to India for her grandfather's funeral and for medical treatment.
I'm really worried that, I can possibly get COVID on top of what I already am going through. So I'm now back in Punjab.
She, like many others, was scheduled to board a Qantas repatriation flight but kicked off after testing positive in pre-flight quarantine. She was asymptomatic. Her test detected a low viral load. Soon after, it was revealed the testing company wasn't accredited. Sheena, like 11 others kicked off, have since tested negative. She's desperate to get on the first flight available.
To be honest, as you can see, the bags are still packed and I'm waiting for it. You're all set to go. You've done everything. You've taken every single precaution that you could. I got a test done on Saturday. I was negative. I had been self-isolating from like 1 month in advance. It's just horrendous. You feel helpless. You know that there is not even a 1% chance you've got a positive, and this has to be a false result.
Living in Delhi, I can say the speed of this second surge has been nothing short of terrifying. India had beaten the first surge, new infections were low, and the country was not only producing vaccines for its population, but also the world. Triumphalism got in the way of clear-headed concern, and in just a few weeks, it went so horrifically wrong.
India is registering about 350,000 cases every day and 4,200 deaths. So that's a very high daily case and death toll.
Officially, more than 270,000 people have died in India from coronavirus so far. Experts think the real figure could be 5 to 10 times higher.
But our models are saying that we are sort of at the peak number of daily deaths as we speak. Things are going to probably slow down through the month of May and June. But the numbers are so high, it will take a while for the death tolls and the infection numbers to go down.
Steve Rocha runs a not-for-profit in Delhi, which usually focuses on educating poor people. But as government health systems collapse due to the sheer volume of sickness and death, charities like his have tried to fill the gap.
Many of our young people that come from marginalized communities like this community that we live in Palikadam, have really no resort to any fallback system. And the only fallback system here today is really the NGO world that we are part of.
Steve and his team of volunteers check in on residents in this Delhi slum to make sure the most vulnerable have the supplies they need to deal with a pandemic, from food to medicine to oxygen. Many of the tanks were donated by science classrooms in local schools.
We're still in a pandemic where cylinders, oxygen cylinders and ICU beds were available at costs that were well beyond the reach of the poor.
The distribution of loss worldwide has not been equal. The poor, I think they have this tension. They don't have the luxury of socially distancing and quarantining. They have to go to work, and in very highly congested areas where infection spreads.
The virus has spread to rural parts of the country where healthcare is poorest. Dr. Matthew Samuel is the managing director of a not-for-profit hospital in the Himalayas. He was instructed a month ago to convert his hospital into a COVID one and now treats 40 COVID patients.
Every 5 minutes I'll get a call, do you have a bed? Do you have a bed in the ICU? Do you have an oxygen bed? Can you send us a cylinder? And the calls are coming as far as 100 kilometers.
But finding enough beds is an ongoing challenge.
But the difficulty is all patients cannot be admitted. Every day in the emergency, we see about 15 to 20 patients who would need admission, and we can take only about 7 or 8. We have seen 31 deaths in the last 21 days, which is a huge number. Sometimes you feel helpless because in spite of your best efforts, you're not able to save them.
He's even had to treat his own friends.
We actually lost 3 of our people whom we knew personally. They passed away, and that has been quite a challenge.
A world away in their living room, the Mandair family can only watch anxiously at the devastation unfolding in their homeland. Their despair is heightened by the fact that their 4-year-old son, Gurfateh Singh, is stuck in India.
He's kind, he's a very playful, funny guy, and we miss him. Yeah.
Gurfateh went to India with his grandmother in September 2019. He was meant to return to Australia a few months later, but the pandemic hit and he got stuck.
As a migrant parent, we also consider that this is a necessity of our culture and everything, that we send him back to be with the extended family, to know his uncle and aunts and grandmother.
As an unaccompanied minor, Gurfateh can't fly home. After Australia shut its borders, Harjinder considered applying for an exemption to leave his wife and daughter to travel to India to get his son back. But the threat of getting stuck there was just too much of a risk.
My wife is not working, I'm the only sole earner, and I would have no income then to support my family here as well. But also it's jeopardizing the health and safety as well.
Harjinder Singh wants the federal government to come up with a plan for getting minors back to Australia while the travel ban remains in place.
All I want to say is I want to bring him back, and I need some help from and advice from the Australian government. I've been a good...
So it is quite an unfortunate situation there as well, and this is the kind of situations that we've been talking about, where, minors have been separated from the families. It is really, really unfortunate, and as was mentioned, that it is important that the little ones go and visit their families and get to know their uncles and aunts and grandparents. Under the normal circumstances, it all would be good, but who could predict a pandemic? Well, pandemic, it's not the only thing attacking India at this point in time. Big storms have hit Mumbai. If we can look at this scene of a very popular and a very familiar site to us, the Marine Drive, but never seen it like this. As we know, Bombay is always prone to lots of floods. Whenever it rains heavily because of the poor drainage system there, it always floods. But this is something out of the world. Look at the way all the trees have been uprooted, and especially those big waves coming in on Marine Drive. So, ladies and gentlemen, that's about all we have for you in this segment today. We'll finish off with the upcoming functions and events that are taking place right here in Brisbane. Let's take a look at all of those. So, ladies and gentlemen, that's about all we have time for today in this segment. It's wonderful to have your company. So good that you could join us. And as we know, the main feature for today and the main topic for today has been those international border closures, and especially the ones relating to India at this point in time, because there's so many people who are stuck. Flights have begun, but of course there are precautions. People had to be turned away, and they need to produce that clear certificate before they are allowed to board that flight. So until tomorrow, it's goodbye from me. Enjoy the rest of the day, and most importantly, do stay safe.